I'm excited to talk about GERD. It's one of my favorite subjects because we all in this room know that the esophagus is the most important organ in the body. So I'm delighted to talk about diet and lifestyle changes. Dr. Katz, my esteemed colleague, will be trying to convince you that everybody needs to take medications. So which patients with GERD should use diet and lifestyle changes? It's actually all of them. And we could stop there, but I'm going to talk a little bit more about it. We're going to talk about which diet and lifestyle interventions should we be using and why. So the foundations for treatment of heartburn include dietary modification, lifestyle changes, and medications. We'll save medications for our next talk. There are a number of foods that are classically associated with heartburn and reflux symptoms. If you Google this on the internet, there's a list of thousands of things that you should not eat. The most common things that are recommended include avoidance of caffeine. Once upon a time, little coffee cups were 6 ounces. My grandmother's little cups, she drank a little bit of coffee, but now we all know that kind of the standard size of a coffee is somewhere between 12 and 16 ounces, which is sometimes as much as 300 milligrams of caffeine. High-fat foods are another one that's commonly listed. Alcohol, chocolate, mint, acidic liquids in foods such as citrus and tomato, other foods, onions and garlic, there's all sorts of things, and carbonated beverages. So basically everything fun that you probably ate at dinner last night before DDW this morning. There is evidence that our food choices do affect GERD. In one particular big study, the Nurses' Health Study, there were 8,000 women who were reporting weekly GERD. It was a subset of the big study. And they evaluated their coffee, tea, soda, water, and milk intake. And compared to women who didn't have any intake of coffee, tea, or soda, those who had 6 servings of these caffeinated beverages a day, the risk of GERD was definitely increased. For coffee, the hazard ratio of having heartburn was about 1.34, a little bit lower for tea and soda, but definitely a real thing. Our meal composition matters too. There have been studies that have tracked reflux symptoms or done pH testing for people on a variety of meals with different macronutrient content. And so for those on a high-fat diet, they were more likely to report reflux symptoms compared to a low-fat diet. Same things with a high-carb diet compared to a low-carb diet. When they actually do reflux testing of patients who are taking different types of diet, those on the high-calorie diets tend to have more acid reflux and a higher acid exposure time. Same thing with the high-carb diets.